Hello everyone. So today I have come up with another topic of pharmacology, that is anti-epileptic drug. So these are the drugs which we use for the treatment of epilepsy. Now what is the epilepsy? They are the group of disorder of the CNS which is characterized by paroxysmal cerebral dysarrhythmia manifesting as a brief episode of loss or disturbance in the consciousness. एक तो ये पार्ट हो गया, या तो कॉन्शियसनेस will be there or there will be impaired consciousness or there may be loss of consciousness with or without characteristics body movement, and this episode, single episode, they are called as seizure. It be classified into two: generalized seizure and a partial seizure. Generalized seizure where both the cerebral hemisphere they are involved, whereas in a partial seizure it is only one part of the hemisphere that is involved. Generalized seizure further we classify into various types. One of the commonest is that is generalized tonic clonic seizure. इसको हम grand mal epilepsy भी कहते हैं. Now what is the sequence in this? Here first there will be aura followed by cry followed by unconsciousness. इसमें ऐसे है. So what will happen? So initially it is characterized by a tonic phase where the whole body muscles will be contracted, and in followed by in 15 to 30 seconds there will be a tremor. So tremor, this indicate the relaxation in between the contraction, and slowly what happens, this relaxation phase it will be increasing. There will be increase in the relaxation phase and the person will go into the clonic phase. So here what will happen, the whole body muscle they will be completely relaxed, and after that what will happen, the patient will go into the stupor state or into the deep sleep, you can say. So what else can happen? Tongue or cheek may be bitten. Here respiration may stop, and the cyanosis may develop in generalized tonic-clonic seizure. Involuntarily micturition and defecation can happen in a generalized tonic-clonic seizure. So the whole thing it lasts only for 1 to 2 minutes. So another type of generalized seizure is, here you can see a tonic phase and a clonic phase. Tonic phase where the whole muscles they are contracted, and in a clonic phase you can see the relaxation. So in generalized tonic clonic there will be tonic phase and followed by a clonic phase. The second one is a absence seizure, or also called as petit mal. This is mostly seen in a children, and it happens many times in a day, and duration here it is a 10 seconds. Here just the word say absent seizure. So person will abruptly, the patient abruptly ceases the activity whatever he or she is doing. Maybe if the person is speaking, he will stop speaking in the mid sentence, and if the person is seeing, patient will stare, and there will be momentarily loss of consciousness but no motor disturbance. So patient will not fall, and but patient will not have any memory of this absence seizure. And if you see the EEG show a characteristic synchronous 3 hertz spike and wave pattern, and this is because of there is rhythmic connection between thalamic neuron and, or you can say thalamocortical neuron, thalamus and cortex, and in the thalamus the prominent channel, that is T type of calcium current that is there. So drug which is will be effective against the absence seizure are those which act by blocking the T type of calcium channel. Another one is atonic. So atonic means, that means there will be no tone. So loss of the tone. So person will fall if the person is standing. Okay, and if the person is sitting, then head and torso will droop off in front or back, whatever. Then another type of generalized seizure, that is myoclonic seizure. So myoclonic seizure may there will be shock like momentarily contraction of either limb or whole body. It may happen in any type of generalized seizure. It may happen in petit mal, myoclonic seizure along with the patin liebiosic. It may happen in the generalized tonic-clonic seizure. So these are the four type of generalized seizure. Then second one is a partial seizure, where one part of the hemisphere that is involved, or it is a localized in origin depending upon which part is involved. Like in simple partial seizure, the origin is cortex. In complex partial, then it is a temporal. Then in localized further spread, if it is a minimal spread and it is a widely spread, then if there is a minimal spread, that leads to simple partial seizure, and if it is a widely spread, that leads to the complex partial seizure. So in simple partial seizure, there is just a simple jerk like, clonic jerk like moment will be there, which lasts for 30 to 90 second, but there will be no loss of consciousness, and person will describe no loss of consciousness. Patient will describe, patient will remember everything, and patient will describe whatever has happened to him or to him. Then second one is a in complex partial seizure, where the it starts from there, so it is widely spread, and here what happens, the consciousness that is impaired, there may be loss, impaired consciousness will be there, patient won't be able to recall. And in complex partial seizure, there are integrated movement like automatism that can be seen. Patient may be swallowing or lip movement that will be there. Then another is in complex partial seizure, there is a deja vu phenomenon that is also there. Like person will feel whatever he is seeing or जो भी वो सुन रहा है इससे the person has felt all that earlier also, that is also seen here, but consciousness will be impaired in this. Then partial seizure secondarily generalized, here the person will be having a start with the local, and later on it is going to spread all over, start with the one lobe and then involving the both lobe, that is a partial seizure which is secondarily generalized. There are the few seizure which is not classified under the partial and a generalized seizure, like febrile seizure. This is seen in a children below 5 years of the age. Here what happens, along with the fever, the child will get the conversions. Then infantile, this is seen in the infants, there will be minimal spasm with the mental deterioration. Then Lennox-Gastaut syndrome. This is one of the most difficult to treat, usually seen in 2 to 6 years of age. Here what happens, the child will be coming with every time different type of seizure, and along with that behavioral problem will be there and psychological problem will be there. Then status epilepticus. Status epilepticus, if there is a seizure but no recovery, if the seizure happens for more than 30 minutes without any recovery, if there is a no recovery, that is status epilepticus. And this is an emergency. Suppose if it is a patient with a grand mal epilepsy, generalized tonic clonic seizure is there, then what will happen in between, if there is no recovery, then it is an emergency and you have to treat it, otherwise what will happen, the permanent patient may die, brain damage may happen, and patient may die. So this is how we classify this seizure, the how we classify the various classification of this seizure. And these seizure, whether it is a generalized or it is a partial seizure, it may be primary or it may be secondary. So primary, usually we say it is a idiopathic. Mostly 60 to 70% they are idiopathic. Secondary is if you know the cause. Suppose if there is any infection, किसी को infection हो गया, meningitis हो गया, encephalitis हो गया, कोई head injury वाला patient हो गया, किसी की surgery हो गई, ठीक है. So any in the secondary there are many reasons, but Thing is, the treatment is mainly on the type of, it mainly depend on the type, what type of seizure. So management totally it depends on that. But the underlying cause, if you are able to diagnose what is the cause of seizure or epilepsy, so you have to treat the cause also along with that. Now, why this seizure happen, what is the pathophysiology of this seizure? So in the brain, the neurons, they are connected, both excitatory and inhibitory neuron, they are connected, and there is a balance between these excitatory and inhibitory neuron. If any imbalance happens between this, now how these neurons, they are interconnected with one another. So there is a electrical this connectivity between that by the generation of the action potential. So as you all know, the connection between one neuron and another neuron is by the electrical impulse. So look at the another figure. So here is a one neuron. So this is a communication, how excitatory and inhibitory neuron, how they are going to communicate. So this is a excitatory, you can say, the glutaminergic neuron. So at rest, there is inside the negative ions that is there, and outside the positive ions that is there. So what happens with the activation? There is an influx of this sodium ion. Once this sodium ion it enters, then what will happen? This will be reversed. ये आपका positive or negative, and what will happen? Inside positive will be there and outside negative will be there. So then what will happen with this movement of the positive ion, this action potential that is generated. Once this is generated, then there is a inward movement of this calcium. This little bit movement of the calcium, it is going to cause, this is a vesicle, storage vesicle, and where glutamate, GLU, that is a glutamate neurotransmitter, this is stored. Now once the calcium enters, this is going to cause a fusion of this vesicle with this neuron, and ultimately the glutamate that is released over here, and this glutamate, it is going to act on the various receptor, inotropic receptor, like NMDA, N-methyl D aspartate, EMPA receptor, and KNET receptor. And once they are going to act on these receptor, you can say there is a movement of the, with, if there is a, if it is acting through an NMDA receptor, there is an inward movement of the calcium ion. If there is a, it is going to act on the AMPA receptor, then there is a inward movement of the sodium. If it is a KNET receptor, then again there is an inward movement of the sodium. So positive ion that is moving inside, that leads to depolarization. Now this is a excitatory neuron which is going to cause the excitation, but in the central nervous system there is a check, there is some other neuron which is going to cancel the effect of this, which is going to make a balance between this. Agar ye balance now, then it is going to cause the excitation only. So how the balance that is maintained? There is another inhibitory neuron, that is a GABAergic neuron. So this GABAergic neuron transmission, यहाँ पे भी बेटा सेम है आपका, the negative ion that is inside and outside that positive ion that is there. And what happens whenever there is activation, then inside the sodium ion will move inside, then action potential will be generated, and this side calcium that moves, and this is going to cause a fusion of this vesicle with this membrane, and there is a release of this GABA, and this GABA, once this is released, this is going to act on the receptor. This receptor, it is a GABA A benzodiazepine chloride complex. This is going to act on this, and once this binds with the GABA A receptor, there will be inward movement of the chloride ion, which is a negative, and that leads to the hyperpolarization. So this is a check between the glutaminergic, and there is these two neurons, they are in balance, so there will be no seizure. So when the imbalance happens, suppose increased activity, अगर इसकी activity बढ़ जाती है, that leads to seizure. If GABAergic activity that is decreased, reason may be anything. Maybe if there is a decreased synthesis of GABA, अगर ये आपका glutamic acid, how the GABA this is synthesized? This is synthesized from the glutamate. The glutamate में आपका glutamic acid decarboxylase. This is GAD. This is a glutamic acid decarboxylase. Once this act, then what will happen? it is going to convert this glutamate into GABA, and once this GABA it is released, it is reuptake by the GAT, that is GABA transporter 1. So reuptake, once it is reuptake within the neuron, then it is metabolized by enzyme, that is GABA T. T stands for transaminase into the various metabolite. Okay? So decrease GABAergic transmission if suppose there is more reuptake, more degradation, then all that leads to what will happen, the inhibitory activity will be decreased. So there should be a balance between this neuron and this neuron. Now how the anti-epileptic drug they are going to act, what they are going to do, so they are going to bring the balance back. They act by decreasing ये वाली साइड की एक्टिविटी जो है, दे आर गोइंग टू डिक्रीज द एक्टिविटी ऑफ दिस साइड, इस साइड की एक्टिविटी वो क्या करेंगे, कम करेंगे, ग्लूटामिनर्जिक. So how they are going to decrease the activity of glutaminergic? Maybe by blocking this channel, sodium channel, by blocking this calcium channel, by acting on this receptor. ठीक है, ये हो गया. And how another way they anti-epileptic drug they are going to increase this GABA transmission. So they may be GABA mimetic, GABA facilitatory. They may increase the synthesis of this GABA. They may decrease the degradation. They may decrease the reuptake. So they are going to increase the GABA transmission. This is how the anti-epileptic drug they are going to act. So what they do, anti-epileptic drug, what they do now, you can see here, they are going to modify. So this part is about the, they are going to decrease the activity of the excitatory neuron, and this part is they are going to enhance the activity of inhibitory neurons. Inhibitor, they are going to enhance the GABAergic neurotransmission, and they are going to decrease the activity of the excitatory neuron by modifying the ionic conductance, that is blockade of the depolarization channel sodium and calcium. So calcium आपको बेटा T type of calcium channel that is also there, so they are going to decrease the calcium current from the T type of calcium channel also. Then second one is they are going to diminish the glutamate transmission. Once the glutamate that is released, then further they are going to diminish the glutamate transmission by acting on NMDA receptor, AMPA receptor and a KNET receptor. Then another way how this anti-epileptic drug they are going to act, that is by the potassium channel opening. By the potassium channel opening they are going to in the activity in the excitatory neuron they are going to act. So by opening this they are going to cause a hyperpolarization. Then another one is by blocking the effect of neurotropic factor, so that is collapsin response mediator protein. So what this action of this any drug which is going to act by CRMR2, here आपका abbreviation CRMP2. So what they are going to do, so this one it is they are going to drugs which is act by blocking this. So usually this protein it is going to act on the neurotropic factor like brain derived neurotropic factor and neurotropin factor 3. Sorry, यहाँ पे लिख दे neurotropin factor 3. It is going to act on these two. So by acting on these two factors, they are going to cause the neuronal growth, dendritic growth and axonal growth. If any drug, if it is going to block this, then what will happen? The neuronal growth will be hampered. So anti-epileptic drug, the basis of pharmacotherapy of majority of the anti-epileptic drug, they are going to decrease the excitation and increase the inhibition, right? So increase inhibition कैसे करेगी? By increased binding of GABA and increased synthesis of GABA. And how they are going to decrease the excitation? By decreasing by blocking this sodium channel and a calcium channel, by diminishing the activity of these, by acting here, by acting all these. So this is the basic about the anti-epileptic drug. In the next video, I will be taking up all these drug one by one. So drug which act by blocking this, and the drug, what are the drugs which act over here, T type of the calcium channel, what are the drug which enhance the GABA transmission, and what are the drugs which is going to act by opening the potassium channel or acting on CRMP2 proteins. So that's all. If you like my video, so kindly subscribe my channel and put up the important comments in the comment box.